Baik, teman-teman, saya ingatkan sekali lagi.
Very well, ladies and gentlemen. Welcome to our third webinar. And once again, please fill in the attendance form using the link provided in the chat. bit.ly/absencyhaze3. I would like to reintroduce myself. My name is Natalie, and I will be your Master of Ceremony and moderator today. Now, before we start, I would like to also introduce about HAZE and the people behind HAZE. HAZE stands for Hastening Zero Air Pollution. It is a collaboration in the form of a capacity building by CIMSA, Inspire, and Vital Strategies. CIMSA is the Center for Indonesian Medical Students Activities, and we have 6 standing committees that are focused on various areas, including, among others, SCORP. SCORP focuses on post-disaster management, rights to health, rights of refugees, and the vulnerable groups. Inspire, Health Advocates for Clean Air, is a collaboration initiated by Vital Strategies. Inspire's goal is to mobilize a global coalition of clinicians, public health professionals, and organizations to advocate for clean, healthy air. It is certainly our pride, CIMSA and Inspire, to have a collaboration to conduct the HAZE webinar. The HAZE collaboration consists of 3 sessions. The first session has been conducted in November of 2020. The second webinar was conducted in March of 2021, and the third webinar will be held today. And our theme today is Local Cleaner Advocacy. And we will now hear from Xiaogi as the National Officer for Human Rights and Peace from CIMSA for 2020-2021. Xiaogi, the screen is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good evening.
Greetings, may peace be upon us.
I would like to say thank you to each and every one of you for being here at this wonderful occasion, especially to Ms. Karis as the representative of Inspire, and also our speaker, Mr. Neil Schluger, and our moderator, Natalie Audrey. My name is Ogi, as National Officer on Human Rights and Peace, CIMSA Indonesia. It's such an honor for me to speak on behalf of the organizer and SCORP CIMSA. And let me begin by giving you a warm welcome to the third intervention of HAZE, Hastening Zero Air Pollution. In this previous intervention, we already informed you about the relation of COVID-19 and air pollution, and the second one, it's mainly talk about the local movement. And in the final intervention, we are focusing to bring up the advocacy through the local movement. And we hope SCORP CIMSA and Inspire hope this intervention will give you the information, and we hope that this intervention will increasing the knowledge of medical practitioners through the 3 series of capacity building of HAZE. And I hope all of you can enjoy this session, and thank you very much for being here, and wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih Xiaogi untuk sambutannya.
Thank you very much, Xiaogi, for the opening remarks. Now I would like to introduce our speaker today. Today we have Mr. Neil Schluger, Doctor of Medicine. He is a representative of Vital Strategies, where he is the Senior Advisor for Science. Mr. Neil is also a chair of the Department of Medicine at the New York Medical College. And in addition to that, he is also a director of the Department of Medicine at Westchester Medical Center. Very well, without further ado, I would like to give the screen to Mr. Neil to deliver his material today.
Thank you very much, Natalie and Siogi. It's wonderful to be here with you today, and we're happy to have so many participants. What I would like to do with you this evening is provide some context for the activity we're going to do in the breakout session. And that is really to focus our attention on local sources of air pollution that might have important effects on children, on adults living in various parts of the country. And so I will give you an overview really of how these very local micro environments can have enormous impact on individual people. So let me share my screen. Okay. You should be able to see that. Yep. Okay. So this is really the subject, the idea that air pollution is both a global and a local issue. If you start at a global level, you see on a map like this that unfortunately most of the people in the world, 90% of the population of the world, lives in places where the amount of air pollution exceeds the World Health Organization standard for healthy air. The World Health Organization says that for air to be healthy, the concentration of particulate matter, of fine particulate matter, what we call PM2.5, should be less than 15 micrograms per cubic meter. That's the very lightest color on this slide. And you can see that although there are many countries in the world that are achieving that standard on a national level, there are also many, many countries in the world that don't achieve that on a national level, including Indonesia, which exceeds the WHO standard. But really, even in countries that are above or below the WHO standard, the real issue often becomes a very local one. I just want to show you in a little more close-up, Indonesia, Indonesia has levels of air pollution generally for the country as a whole in the 30s, 30 micrograms per cubic meter of PM2.5. That's about twice the WHO standard, and the number of deaths in Indonesia attributable to PM2.5 air pollution has been rising really for the last 30 years, and now over 100,000 deaths per year are felt to be related to air pollution. But as I mentioned, the national story or the global story is not always the same as the local story. So you can have places in urban environments, for example, that have much cleaner air than other places in urban environments. And I'm showing you these two photographs for a particular reason that we'll come back to later on. But this is a picture on the left of Hyde Park in London. It's a beautiful park in the middle of the city. You can see there's lots of open space and green grass and trees. And it's a very nice place to walk in London. On the right, you see Oxford Street, which is a busy commercial street in London, lots of stores and shopping, but also lots and lots of traffic here on Oxford Street in London. Not very many open spaces, not any trees or green grass or open sky. So busy commercial street. And most big cities in the world have spaces that are either like Oxford Street or like Hyde Park. Similarly, in urban areas, you're often exposed to street traffic, which can be very dirty. This is a photograph that I took from work that I do in Ethiopia. And this is just trucks. You see here trucks that are burning diesel fuel, and this diesel exhaust is very, very dirty. And if you're walking down the street, you're exposed to this all the time. Another photograph from Addis Ababa in Indonesia showing all this terrible pollution coming out of a smokestack, probably that's burning industrial waste in this building, in this particular example, but industry is a major source of air pollution. And again, you see this kind of air pollution in many parts of the world. Cook stoves are an important source of air pollution, and we usually think of cook stoves mostly as a cause of only indoor air pollution. Cook stoves cause pollution in many parts of the world because the fuel used in the cook stove is solid fuel, wood, charcoal, animal dung, crop residues, things like that, that burn very inefficiently in the simple kind of cooking stoves that people use in many parts of the world. So you see this cook stove is burning wood here. and a lot of smoke is coming out. And if you just walk in the alleyway outside where this cook stove is placed, you can see this haze all throughout the streets here in this alley. And so indoor air pollution, which is a terrible problem in and of itself, also contributes to a certain degree towards outdoor air pollution, perhaps as much as 25% of outdoor air pollution in places where there's a lot of solid fuel or biomass fuel being used for cooking. And this is a common problem around the world. You can see on the left, this map shows you the proportion of the population in countries around the world that rely on solid fuel or biomass fuel for cooking. If you focus here on Indonesia, where about 33% of the population uses solid fuel for cooking. And you can see that around the world, in some places, sub-Saharan Africa, 85% of the population is using solid fuel, but only in a couple of regions, South Asia and Southeast Asia among them, have the rates of solid fuel use been coming down over the last several years, but they're still quite high. So Southeast Asia is still 40% of the total population, a little bit less, as I mentioned, in Indonesia, but 40% of the total population using solid fuel for cooking. So this is a substantial contributor to outdoor air pollution. Trash burning, another local source of air pollution. This photograph I took, and you can see that here's some trash being burned, but as more trash is added to the fire, and the fire is stirred up a little bit, you notice the haze that spreads all over this photograph. You know, sort of clear here while nobody's really doing too much, a little bit of smoke here, but once you start adding things and stirring the fire up, you get this haze that's all over the environment. And so if you're close to places where either household trash is being burned or industrial trash is being burned, you can be exposed to high levels of outdoor air pollution. Another source, I showed you photographs of a truck burning diesel fuel in downtown Addis Ababa. But even if you're not walking down that street, you may be exposed to exhaust from traffic in many different environments. So on the left is a photograph of New York City, on the right, a photograph of Jakarta. And you can see in these areas where there are lots of residential buildings, these high rises, there are also highways that are running through. So here's highways running through New York, a highway running through Jakarta, and living close to those highways exposes people to high levels of air pollution. These are some data from a study that was done in the United States where these scientists looked at lung function represented by the forced expiratory volume in 1 second or the forced vital capacity. They examined lung function relative to how far people lived from major highways. And you can see that if you lived within 400 meters of a major highway, you had worse lung function than people who lived more than 400 meters from a major highway. And the average level of PM2.5 in these areas was only 10.8 micrograms per cubic meter. So that's a point that I was trying to make earlier. If you go to the area where this study was done and just said, okay, what's the level of air pollution? It looks like the air is pretty clean. 10.8 is within the WHO standard for healthy air. But once you get down to this micro environment and ask people, well, how far do you live from a major highway? You can see that people who live within 400 meters or even closer, within 100 meters, have lung function that is clearly worse than people who live more than 400 meters to the major highway. Okay, now I want to take you back to the example I started with in London, the Park, Hyde Park, and Oxford Street, and show you two studies that were done with people walking in that park or walking down Oxford Street. In this study that was done about 13 years ago, scientists looked at lung function in people with asthma when they were strolling in the park. or walking down this busy commercial street. Now, in the park, the level of PM 2.5 air pollution was only 11.9 micrograms per cubic meter. Again, within the WHO standard for clean air. When they walked on Oxford Street, they were exposed to air that had a level of PM 2.5 of almost 30 micrograms per cubic meter. That's twice the WHO standard. And what you can see here is that while people were walking in Oxford Street, their lung function in people with mild or moderate asthma was just a little bit below what it was before they started their walk, pretty close to normal. But when they were walking on Oxford Street, they had a 5 to 6 or 7 or 8% drop in their forced expiratory volume in 1 second, an important measure of lung function. So just walking in different parts of the city for people with asthma will affect their lung function in different ways. And the same is true for people with COPD. This is a very similar study done also in London just a couple of years ago. Again, they had people with COPD walking in the park or on Oxford Street, and you can see, again, the levels of air pollution in the park much, much lower, lower levels of black carbon, lower levels of nitrogen dioxide, lower levels of PM 2.5, and even ultrafine particles. And in fact, when people who were healthy or who had COPD were walking in these different areas, they had better lung function when they were walking in the park than they did when they were walking on Oxford Street. So again, what I'm trying to show you is the importance of these microenvironments within countries that may, on the whole, have very clean air or very dirty air, but it really depends where you are within that particular country at any given time. Now, as a result of data like this, these two studies I showed you looking at asthmatics and people with COPD in London, there was an attempt to close Oxford Street to car traffic. And you can see here in 2016, the BBC reported that, in fact, Oxford Street was going to be closed to traffic and turned into a pedestrian throughway. And in fact, it looked like 2 years later that the general public was in favor of that. You see this headline in BBC News, that traffic-free Oxford Street was backed by the public. But ultimately, this didn't happen. You can see Oxford Street pedestrianization plans ditched, so that if you're in London, whether you're a person or a statue, and you really wanted to protect yourself, the only thing you could do was, strap a N95 mask to your face, which really isn't much of a solution at all. I think most of us are frankly sick and tired of wearing masks for COVID, and we're looking forward to taking them off, and we don't want to have to keep them on because there's so much air pollution. The failure of this plan to close Oxford Street to traffic may have in part been because there really wasn't effective enough advocacy. There were lots of groups that wanted to have cars on Oxford Street for a whole variety of reasons, and it seems like there wasn't strong enough advocacy on behalf of the general public from people who really understood and cared about air pollution, and that's one of the reasons we've been holding these seminars with CIMSA. Now I want to finish talking about children. Children are extremely susceptible to air pollution, in some ways more susceptible than adults are. Here you see some children walking to school in Indonesia. Here you see a demonstration by some children in London. This says on their sign, it says no nitrogen dioxide, dirty air. So they want clean air. Why is this so important for children in particular? This is a very important study that was done about 6 years ago in the United States, in California. And I'll just give you the general overview. What this slide is showing is that in 6 cities, or 1, 2, 3, 4, in 5 cities, in Southern California, the western part of the United States, over a period of time, the air got cleaner. Levels of nitrogen dioxide in these cities went down, and levels of PM 2.5, the levels went down. And as that was happening, these investigators were able to show that the rate of lung growth in children ages 11 to 15, as the air got cleaner, the lungs of those children grew more. And what this points out is that, as you know, lung development starts at birth and continues till about the age of 25. Once you're older than 25, actually you start to lose lung function. Sorry, that's the bad news. I'm way beyond that. Most of you look like you're right about at that point. But that time from 0 to 25 is extremely important, because if you don't reach your peak potential lung function by the age of 25, you have a very high chance of having lung disease later in your life. So children who are exposed to high levels of air pollution will not reach their full potential of lung development and will be in a position where they will have lung disease later in life. So looking at the closeness of things like schools and playgrounds to high levels of air pollution in places where children are living is an important thing to do to try to protect these very vulnerable young people. So what I would say in conclusion is that air pollution certainly is a global issue, but it's also a very local issue. Country level data about air pollution is very important, but it doesn't tell the whole story. Within countries with average levels of air pollution that are acceptable, there may still be areas that are heavily polluted, as I've shown you. And within countries where average levels of air pollution that are unacceptable, there might still be areas that are not heavily polluted, parks and things like that. So identifying areas within countries or cities that have very high or very low levels of pollution is important for advocacy aimed at protecting vulnerable populations. And that's what we want to focus on in the breakout sessions that we'll have, to have you understand in the places where you live, what are the local sources of air pollution. So with that, I'll stop. I don't know if there are any questions just now. If there are, I'm happy to take them. If not, Natalie, back to you.
Okay, thank you, Neil. Untuk teman-teman yang ada
For friends who, if you have any questions, please raise the question and please write it in the chat box. I'll wait until 19:35.
Before we go to the participants' questions, I guess myself, I want to ask you something, Neil.
Okay.
From your presentation, I perceive it as some kind of structural problems. For example, because people still need to commute, they won't just accept a plan to make the street pedestrian. And then people with lower economic status, they have no choice other than to live near the emission source. What do you think we can do as the future healthcare professionals? Like, how can we tackle this issue? Because it is not, I guess, it's not something that can be done just by a one step. I think that's my question.
Right. No, that's a very, very good question. And you're absolutely correct. We can't, some people can walk to school or work, but some people can't. They live too far away. So just getting rid of cars completely, is not really a solution. So what other things can be done? I think there are several things. One is we can provide incentives for cleaner fuels. So if you're living in a place that has a lot of vehicles that still, older vehicles that still burn diesel fuel that is very, very highly polluting, we can try to get the government to provide incentives for people to buy newer vehicles that will burn cleaner fuel and burn whatever fuel they're using more cleanly. In many places, I know a place where I've done a fair amount of work in Ethiopia, it's very expensive to buy a new car, even though it would be better for the environment. It's cheaper to buy an old car. So perhaps the government can do something to provide economic incentives to allow people to buy new, cleaner cars and make older cars, if anything, a little more expensive. Another thing that we could encourage is the use of public transportation or mass transportation, just to reduce the number of cars on the road. If there were efficient buses, newer, cleaner buses that can take 80 or 100 people instead of 100 cars each taking 2 people. You could have one bus taking 80 people or something like that. Some cities like London actually have also adopted things like congestion pricing. They say, okay, at certain parts of the day, we're going to charge you extra money to drive into the middle of the city because we want less traffic. And so that would encourage, again, people to use either carpools or mass transit. So I think those are some ideas for solutions to the problem.
Okay, thank you very much, Neil, for the answer. It really answers my question, and I hope the participants here also get your point. So I guess there's no other questions from the participants. So we will move on to the next agenda. Thank you very much, Neil, for your presentation. It was really informative for us.
Okay.
Teman-teman, untuk agenda selanjutnya, sebagai
For the next agenda, as a form of encouragement or support for in advocating the air pollution in the local areas, CIMSA and vital strategies advocate air pollution will be explained by Priscilla Kusuma Wardeni. It is the director of CIMSA 2020-2022. Priscilla, the screen is yours. Good evening, ladies and gentlemen. Thank you very much, Natalie, for this opportunity. Good evening, Neil and from Karis from Vital Strategies. Please share the presentation. Thank you very much. Good evening, CIMSA. Thank you very much for organizing HAZE in this evening. And this evening, Priscilla, I would like to present regarding the process in the theme of air pollution, which is initiative of SCORP CIMSA and inspired by Vital Strategies. And so actually this guide, what is this guideline for? This is a guide to help you understand, execute, and evaluate the impact of when you advocate air pollution in your own respective areas. Together with SCORP CIMSA and Vital Strategy, we would like to make a guideline that to help you to make a grassroots movement in your locals.
Siapa yang dapat menggunakan?
Who can use it? You and all the CIMSA's locals with the urgency of making actions towards eliminating air pollution. If you feel that you have air pollution issue, then you have the right, when you have the right of clean air for better society health, then use this guideline to do advocacy. And what is to be discussed in this guideline? First, what kind of stakeholder? What kind of stakeholder that should be approached? Partners for local, audiences you should work, and what to choose between digital campaign and offline campaign, steps on doing the advocacy, priority actions, and also SCORP stances, template for public comment, and the role of CIMSA locals.
Yang pertama adalah what kind of stakeholders.
The first is what kind of stakeholders. What kind of stakeholders?
Udara di lokal kalian masing-masing. Nanti akan dibahas juga karakteristik dari setiap.
It will be also discussed about the characteristic and how to get near to them based on the characteristics that they have.
Partners for locals. Akan dimasukkan nantinya rekomendasi-rekomendasi.
There will be recommendation that could be approached in the local scale to explain about the specific advocacy method that you can take.
Selanjutnya, audiences you should work.
Audiences you should work. We know that it is impossible that we advocate an issue only to the policymakers. We also have to try to make efforts to the society to care about their condition regarding the air pollution issue and also their right to have a cleaner air. And here we will discuss about the types of society that we should be able to educate.
Selanjutnya adalah what to choose.
And next, about what to choose, digital campaign or offline campaign. As you know, during the pandemic, we see there is a media social campaign and when it's possible to do offline, we could also campaign in your local areas directly and then face-to-face meeting with the society. And next is steps on doing advocacy. Here it will be discussed in details how to conduct a good advocacy and also recommendations from national so that locals could conduct advocacy. It is expected that when you do advocacy, all the local friends understand how to design and to execute and to evaluate in order they could give a sustainable impact. And next is priority actions and also scope stances on air pollution. This is one of example that I took about the rights to clean air. Here it will be discussed specific topics which could be advocated in the local areas. And also there is a background and also the future in CIMSA and how we could do advocacy in the local scale. And the last one is the role of CIMSA's local, or it's a conclusion. So the CIMSA's locals could conduct, what could they do to advocate about the clean air? The advocacy that could be done in the local scale to help advocate for cleaner air and also the roles of CIMSA's locals in the locally, nationally, and regionally. We hope that the guideline that will be formulated will help you to eliminate air pollution and also get the rights for cleaner air together. If you have input or if you have a request for topics of discussion, please input in bit.ly/for cleaner air. I hope your input could be realized in this guideline and it will be able to help for the grassroots movement for the CIMSA's. Thank you for your attention.
Akan ada sesi lainnya dari HAZE dan terima kasih
banyak. There is another session from HAZE and thank you very much for your attention.
Terima kasih Priscilla untuk pemaparan mengenai.
Thank you Priscilla regarding your presentation about advocacy Ghana on air pollution.
Setelah kita mendengar banyak informasi baru,
after we listen to the new information, which is really insightful for all of you, the next agenda is breakout group discussion. How is the mechanism of the discussion? It will be explained by Shogi. Thank you very much. Natalie, can you hear my voice? In the breakout room activities, there are two agenda for discussion. In general, we call this is scavenger hunt. And so first of all that we have prepared for you is instruction in PowerPoint slide. So I'd like to share screen. So this is the examples of the PowerPoint. This is containing instruction, and also there is blank maps of the city. All your universities are there, and also there are icons of the important buildings, and also icons of the emission, the big emission producer like schools or the landfill, and also terminals, etc. And also we also provide link for maps where there are air quality monitors. And the last one that we will provide you is resources. For example, from the places that produce air pollution. For example, the landfill Bantar Gebang in Jakarta that has been adjusted to your local areas. First, what you need to do is to open the air quality monitor, first of all, and then to check where is located where the air monitor. After you have checked that, then you could place the icons, icon diamond. The icon diamond were in the air quality monitor on the blank map that has been provided. And so the diamond is placed on the respective place um, on the map that has been blank. And so this is the example of the map. This is the map, which is a blank map, and you will have to place the diamond
Setelah
on
kita
that.
mengecek tempat air quality monitor, kita mengecek
After you check the air quality monitor, you check
itu berdasarkan reference list. Setelah kita menemukan
based on the reference list after you found it, and then you put icons according to the category of the pollution emission, and then also put in the maps. After that, you could use nearby features to determine which areas or which sites which is close to that area, for example, school or housing area or hospitals, etc., which is also going to be adjusted with the categorization. And also after it is done and completed, then the map with the, then we go to the second step, and then you have to answer questions. This is questions on the with stakeholders that you could meet to overcome, to manage the air quality monitoring. And then you could do any activities. You can also which any stakeholders. And then after that, again, back to the plenary to make your presentation. So that's the activity in the breakout room. And then next, you can go to your respective breakout out, and then you could ask, if you have any question, you could ask to your facilitator there. Thank you. Thank you very much for your direction, Shaugi. And so please enter the break room that has been provided according to the assignment. It is based on the region usually, but because this we do not have too many participants, so region 1 and 2, region 3 and 4, region 4, 5 and 6, and region 7 is alone. In the breakout room, there will be facilitator will guide the discussion. And so the friends and facilitators, please enter the respective breakout room. Thank you. Have a nice discussion.
Oke, karena sepertinya sudah kembali semua ke
I think all of the participants have returned back to the main room. So thank you very much once again for having a discussion in each of your breakout rooms. Our next session will be presentation from each of the breakout rooms. So do we have any volunteers to be the first group to give a presentation? Please feel free to use the chat box. Please specify your region. Okay, so for region 1 and 2, the screen is yours. You have 5 minutes. Thank you very much. So please allow me to introduce myself. My name is Sabrina, and I am representing region 1 and 2, and we will present our discussion. So we had a discussion about the Padang and Pekanbaru city. For the case of Padang, the main focus or the main issue is the air quality control and how it lacks indicators. We only have one indicator. We then carried out various advocacy efforts. And in this case, the targets are, for example, the education office in Padang to have 1 day no meat in school to reduce footprint. And we also want to involve the transportation office To better regulate the quality and quantity of public transportation, we also want to target the sub-district with regards to regulations, to impose sanctions, and also, in this case, to give some sanctions as well to those who still throw their rubbish. For the case of Pekanbaru, we found that there is an unequal distribution of air control monitoring. For example, it tends to be centralized. And with regards to the quantity, there is actually quite a sufficient amount. Unfortunately, it is not equally distributed, even in cases where there are a lot of congestion and so on. For the case of Pekanbaru, we also have a significant number of factories. The advocacy that we are planning in this case is to target the mayors and also the relevant agencies to once again better improve the regulations we have. And we want to also give a special focus on the Ministry of Public Works so that they can also give concern on the spatial planning. Hopefully, we can also better strengthen this aspect. So, for example, by having more distance in the residential areas and to have more green areas by setting a total of about 0.5% for that. And with regards to the environmental impact assessment, there are also thoughts of how, in this case, factories do not require reforestation. And in the past, for the case of coal mining, for example, there were some requirements to carry out reforestation, but unfortunately, this was then revoked. Now, we believe that this policy should actually assist the prevention of pollution. So we hope that this can once again be reevaluated, and if possible, it can be re-implemented once again. So that is the discussion in Region 1 and 2, and I invite my other colleagues to add to that as well. Thank you very much to Region 1 and 2. And next, perhaps any inputs from Caris or Neil? Any feedback for Region 1 and 2?
I think you're
Thank
ready.
you.
Oh, Carice, go ahead.
I'll just say a couple words before you jump in, Neil. But thank you, Group 1 and 2 or Regions 1 and 2 for that great presentation. It was really impressive to see all the different kinds of things that you were able to identify on your map. And I noticed that you began your discussion with a criticism or some thoughts about the degree of air pollution monitoring that's happening in that particular region. Referencing back to Neil's discussion about how microenvironments can really tell a different story about the level of air pollution and the narrative around air pollution exposure, then just maybe one reading can or one summary of air quality status for an entire nation or entire region. I also wanted to just comment on, I thought that you guys did a really thorough job of looking at the different stakeholders that might be relevant for some of the emission sources that you were focusing on, especially as it related to public works, as you said. And I think some of the plans and the potential around that stakeholder engagement was very impressive and tied very closely to the emission sources that you identified in the map. So I think that was a really great presentation, and thank you so much. Neil?
Yeah, I would just echo what Chris said. I thought especially identifying the lack of monitoring was very, very important, because I think that we always say in public health that you can't do anything about a problem if you can't measure it. And not having access to monitoring is an important omission, and also provides a very good target for some advocacy. it's really the first step to be able to change anything, is to be able to document the degree of pollution generally, and as Chris was pointing out, in microenvironments. So very well done. Good job.
Thank you, Chris and Neil, for the feedback. Terima kasih juga untuk kelompok 1.
And thank you as well to Region 1 and 2. Thank you for your presentation. So we still have some time. So I think we have time for one more group to give a presentation. So do we have any volunteers here?
Kita masih ada waktu sampai 2050.
We still have time until 2050. So I'll give you an opportunity to share what has been discussed earlier. Okay, next, for Region 7, the screen is yours. So 3 minutes for the presentation. Good evening. We are from Region 7. In our discussion just now, we tried to find data from East Java. At the beginning, we intended to find the East Java data. After we tried to find the data that we found, we didn't find much data in a big city like Surabaya, where it's the capital city of East Java. Then finally, so what we would like to present is related to Surabaya. And you will be able to see in the map at the beginning, there are some icons which is distributed, more distributed compared to the previous one, because we didn't focus to those cities. The first motion is the change of landfill. In the cases that we found in this region, in this big cities, the large cities the density is higher, and so the need of landfill is higher. And because it is already dense, the population is dense, so the bad impact, negative impact should be minimized. And so we suggest to move the landfill to the area outside the city, which is a bit far away from the density. And then but it is not too far in terms of transportation. And so the stakeholder is the Service Office of Environmental Environment at the city level. And the second motion is the additional monitoring air quality control, as I already mentioned earlier. When we wanted to identify the areas, we found a problem where from the data itself, we still lack of data for the monitoring air quality control. From the data that we found, it is dominated by large cities, and that's why we asked for additional monitoring air quality control outside of the big cities, so that it is not only focused on the big cities. The stakeholders is the same. which is the level city of environmental service office. So the third motion is to improve, to add, and to maximize the function of public transportation. Why we include this motion? Because from the data that we found, because it is about air monitoring of quality control in Surabaya, in the big city, it is not too good. And then, and therefore, we would like to improve and to add the facility and also for the public transportation, and then to the transportation service office, and also propose and a campaign to maximize the public transportation. We intend to make this a culture step by step, so that there will be more people using public transport, so that the motion. I think that's all from me. Thank you. Thank you very much for the Region 7 for the presentation. Neil and Carissa, if you have any feedback for the Region 7.
Well, I think you've done a really good job of identifying a very particular issue that I think is a good subject for advocacy and something that could be achieved. And I think what we're hoping with these breakout rooms and with these exercises, that you'll now take this information forward and really try to organize some advocacy activity around them. So I think you really did an excellent job of doing that, and you have now you've identified something, you have a cause, and so I encourage you to continue to follow up and try to work toward achieving that goal. But again, really excellent.
Yes, and I will just echo what Neil said about, really, it's very clear that you were team for Region 7 talking about East Java had a very deep and kind of critical set of conversations about not just what the pressing sources were, but the publicly available air quality monitoring data. And it seems like there was a good discussion on the gaps associated with that, as well as a really context-specific emission sources that are happening in East Java, particularly around waste management and landfills and trash burning. One thing that I just want to point out as a kind of a similarity between Region 1 and 2 that presented earlier, Region 7 that presented now, and I'm sure 3, 4, 5, and 6 in between there, I'm sure you're doing the same things, but there's this theme of having your advocacy objective be pointed at sort of infrastructural changes and larger kind of community or public works projects, as opposed to individual actions. And while some of the, if you had attended earlier HAZE sessions in November and in March, we did talk about some individual actions that might prevent or help you mitigate some of the effects of air pollution as an individual. But what we continue to press on, and it seems like that message has certainly resonated with this group, is that these kind of larger scale activities that target emissions at their sources is really the most sustainable approach to improve air quality. So I know that Region 1 and 2 were focusing on or noted several stakeholders within these public departments, including public works and environment and environmental health, and this group with Region 7 certainly noted the transportation departments, as well as waste manage, or the government officials responsible for waste management in the region as well. And I just want to congratulate you and echo the importance of involving those kinds of stakeholders that do have influence over these larger scale activities. So job very well done to you, Region 7, and thank you for sharing on your discussion.
Thank you, Chris. Thank you, Neil. Dan terima kasih teman-teman dari Region 7 yang
Thank you
sudah
for our friends in Region 7 that have shared the discussion to all of us here. With the conclusion of the presentation, the last presentation, so we also conclude our activity today. May I conclude that from the session today, we know that at the moment, there will be more than 90% of people live in the area where they live where the air quality is worse than the minimum set by WHO. For example, in Indonesia, the PM 2.5 is achieved 30, which is double than the WHO standard. And then the death is increasing from year to year, more than 100,000 deaths every year. And apart from the pollutions, which is caused by the motor vehicles and also industrial plants, and also from the landfills, even indoor air pollution contribute to the outdoor pollution. And for our colleagues here, you have to take note that air pollution is a global issue, but we also have to pay attention in the local areas around us, what is happening and what is the condition. And we as the medical students should be able to do advocacy as there are advocacy guide that you could follow. And based on the discussion today, I hope that you could take sustainable measures to advocate clean air. For example, by using public transportation, reduce the motor vehicles on the roads, and also advocacy and other recommendation. To conclude our session today, I'd like to thank Caris, who as the representative of the vital strategies, and to Neil, our speaker today, and to all our colleagues that have actively participated in our discussion. And lastly, before we close, there is a document, we should document, take a photo session today. And so we will have a photo session soon. Thank you very much, operator. That's all our session today. Thank you very much to all who have participated, and hopefully the materials distributed, and then it could be the basis for you to conduct advocacy at the local areas. Thank you very much, and till we meet again in the next session. Good evening.